NEET PG candidates with 0 and even negative scores are now qualifying and securing postgraduate medical seats, including in premier government medical colleges in the country. Despite a public interest litigation filed in the Supreme Court challenging the move to lower the cutoff marks in NEET PG, the counseling data shows that candidates with low marks, even negative scores, are able to secure seats, and some even in single digits are able to get seats in high-stakes specialties like orthopaedics, obstetrics and gynecology, and general surgery. Many with negative scores have received admission in non-clinical branches. The NBEMS notice issued on January 13, 2026 and backed by the Union Health Ministry slashed cutoffs to fill over 18,000 vacant PG seats. Many candidates with negative scores have received admission in non-clinical branches. The NBEMS notice issued on January 13, 2026 and backed by the Union Health Ministry slashed cutoffs to fill over 18,000 vacant PG seats. For general and EWS categories, the cutoff dropped from the 50th percentile to the 7th percentile. Reserved categories now have a 0 percentile requirement, allowing scores in the -2. Even reputed colleges and core specialties witness allotments at unusually low scores. The students with marks as low as 10 are allotted seats in transfusion medicine, while those with 11 marks are admitted in anatomy, and even those with -8 marks have secured seats in biochemistry, particularly under reserved and persons with disabilities categories. It has been reported that an orthopedic seat at a government medical college in Rohtak was allotted to a candidate who just scored 4 marks out of 800. A physiology seat at a government medical college in Tamil Nadu was allotted to a candidate with a -12 score, while a premier Delhi medical institution has seen an obstetrics and gynecology seat go to a candidate with 44 marks, and a general surgery seat was filled at 47 marks. The PIL by United Doctors Front, social worker Harisharan Devgan and others in the Honorable Supreme Court of India challenged the shocking reduction of NEET PG cutoff to -40 marks. Following the PIL, the Supreme Court of India directed the National Board of Examinations in Medical Sciences to file a detailed affidavit explaining the sharp reduction in qualifying percentiles for NEET PG 2025.
Supreme Court has given a remark with respect to the -40 admission on the basis of the -40. Now I tell you the logic which was given by the respondent side on the date of hearing, that they said they are already a doctor. But the problem is they have done their MBBS. They could not clear the NEET PG exam. Now it's not about only clearing. They are taking on the basis of -40 when you are giving admission to any doctor, because now in a NEET PG they will be specialized, and NEET PG as doctors who take admission after NEET PG, they take care of the hospital. Basically the entire health system of the hospital is based on the NEET PG and senior resident. Now when you give admission to such student to particular any department, be it radiology, orthopedics or any surgery things, then it affects the entire public health system. It impacts the patient safety as well. Now Supreme Court has rightly remarked on the same. If you go by the region is the private college mafias. There are several colleges. Their colleges are opening like mushrooms. So there are numbers of seats. They have to sell it. They have to fill it. Just because of on the basis of that, this marks has been reduced. Now, Supreme Court, let's see how Supreme Court reacts, because the Union of India have not filed the reply till date. On the next date of the hearing, it's currently it's the 23rd of Feb. So on 23rd of Feb, Supreme Court will be deciding what would be done in this matter.
Doctors argue that this is arbitrary, unconstitutional and a grave risk to patient safety, diluting standards of medical education that was set by National Medical Commission.
Today, the Minister of State for Health informed the Rajya Sabha that qualifying percentile for NEET PG 2025 was reduced to prevent seats from remaining vacant. However, the MCC third round All India Counselling results reveal a disturbing outcome. Candidates with negative scores out of 800 have been allotted MD and MS seats even in the premier institutes of our country. These will be our future surgeons and specialists. The outcome also indicates that this policy is largely benefiting the private medical colleges, where seat filling appears to be taking precedence over merit. Now, still, the state third round and stray rounds still pending. The situation may worsen further. We are hoping that Honorable Supreme Court will deliver the justice through our IPAL.
Medical bodies like FIMA and FORDA have slammed the decision as a mockery of merit. Doctors warn that diluted standards in critical specialties could endanger lives. The debate underscores the tension between addressing specialist shortages and upholding rigorous merit-based standards in medical education. Medical aspirants and professionals demand fairness, transparency and accountability to protect the future of healthcare in India. We at the Federal will keep you posted of further developments.